Hi, my name is Brian Carter, and I am going to be doing my informational speech for COM 209 Public Speaking. My topic of discussion today is going to be the Patient Protection and Affordable Care Act, aka better known as, I should say, Obamacare. This is strictly an informational speech. Hopefully, you can extract some useful information out of this information I'm about to give for your personal choices and well-being. And with that, we're going to get started. Do you know someone who has fallen into the unfortunate situation of losing their health insurance or not having health insurance due to events they had no control over? This life-changing event can have serious consequences, and we can only imagine the horrific financial disaster that could be looming. Imagine you have this feeling. Imagine if you had this feeling if it happened to you. Let us take a look into the U.S. government's latest attempt to address this national healthcare industry crisis. According to the Center for Disease Control, the percentage of uninsured at the time of the interview was lowest in 1999 and 2005 of 14.2%, and the highest in 2010 of 16.0%. The percentage of the uninsured decreased from 16% in 2012, so it's getting better. It has been a national consensus that the healthcare is the primary concern detrimental to the country's economic viability. The World Health Organization, WHO, they concluded that the United States spent more on healthcare per capita of $8,098 and more on healthcare as a percentage of its GDP of 17.2%. That's more than any other nation. This was discovered in 2011. This is a crisis that cannot be sustained, but the counter argument in our country has been that we have the best quality healthcare system that cannot be matched. The imminent crisis has become politically divisive in our country, but the Patient Protection and Affordable Care Act, aka PPACA, is the current administration's proposal addressing this national epidemic, which became law of the land for now. We're going to examine the information that was released by the U.S. government and supporting agencies so that the general public can be encouraged to further research this topic for their own benefit and well-being. First, let's talk about the key features of the Patient Protection and Affordable Care Act. Our good foundation for us to understand the law by examining the law. New consumer protections are implemented in 2010. The Patient Protection and Affordable Care Act timeline begins in 2010 with the first elements of the Patient's Bill of Rights that took effect. The timeline begins when the first elements of the Patient's Bill of Rights took effect, and according to the law in Title I, consumers will be protected from the worst abuses of the insurance industry within the Patient's Bill of Rights. They include prohibiting the denial of children for coverage with pre-existing conditions. The law also prohibits insurance companies from rescinding coverage due to clerical errors in customers' applications or technical errors, which was a common practice. The Patient Protection and Affordable Care Act also eliminates lifetime dollar limits on essential benefits like hospital stays, on new plans, and individual group market plans. An external review process is also implemented to review all claims and appeals to coverage determinations by insurance companies. The Patient Bill of Rights stipulates that states can apply and receive federal grants and set up or expand independent offices to consumers to help navigate private health insurance, the private health insurance system. Insurance companies are now held accountable for unreasonable rate hikes. Federal funding is increased to allow states to cover additional low-income families and families under Medicaid. Other key elements implemented in 2010 detailed improving quality of healthcare and lowering costs. They include coverage to young adults until they reach the age of 26. Coverage for retirees also expands early retirees who are not eligible for Medicare. Seniors who reach the coverage gap will receive a 50% discount when buying Medicare Part D covered brand name prescription drugs for the next 10 years. The law also allows states to have or plan to implement measures that require the insurance companies to justify their premium increases. $250 million in federal grants will be available for states in effort to fund this effort. According to the U.S. Department of Health and Human Services, states will be able to receive federal matching funds for covering some additional low-income individuals and families under Medicaid for whom federal funds were not previously available. This will make it easier for states to choose to do so to cover more for their residents. The Patient Protection and Affordable Care Act also states details strengthening the availability of primary care. There are new incentives in the law to expand the number of primary care doctors, nurses, and physician assistants. These fundings include scholarships and loan repayments for primary care doctors and nurses. Working in underserved areas, doctors and nurses receiving payments made under any state loan repayment or loan forgiveness program intended to increase the availability of healthcare services underserved or health professional shortage areas will not have to pay taxes on those payments. So, according to the U.S. Department of Health and Human Services, as of today, 68% of medically underserved communities across the nation are in rural areas. These communities often have trouble attracting and retaining medical professionals. The law provides increased payment to rural health care providers to help them continue to serve their communities. In addition, the Patient Protection and Affordable Care Act includes new funding to support construction and expand services at community health centers, allowing these centers to serve some 20 million new patients across the country. So that's pretty good for 2010. Now the law transitions into 2011 and improves quality of healthcare costs and lowers healthcare costs, increases access to affordable care, and holds insurance companies accountable with protections, ramping things up. According to the Patients Protection and Affordable Care Act, over the next 10 years, seniors will receive additional savings on brand name and generic drugs until the coverage gap is closed in 2020. The law provides free preventive services such as annual wellness visits, personalized prevention plans for seniors on Medicare. The law establishes a center for new Medicare and Medicaid innovation, and that will begin testing new ways of delivering care to patients. These methods also expected to improve quality of care and reduce the rate of growth in healthcare costs for Medicare, Medicaid, and children's insurance program, hence CHIP. Additionally, by January 1st, 2011, the Health and Human Services will submit a national strategy for quality improvement in healthcare, including these programs. The Community Care Transitions Program will help high-risk Medicare beneficiaries who are hospitalized avoid unnecessarily readmissions by coordinating and connecting patients to services and their communities. The Independent Payment Advisory Board will begin to develop and submit proposals to Congress, President, and the President, aimed at extending of Medicare, the Medicare Trust Fund. This board was established to focus on ways to target waste in the system and recommend ways to reduce costs and improve health outcomes for patients, and also expand access to high quality care. The Community First Choice option allows states to offer home and community-based services to disabled individuals through Medicaid rather than institutional care in nursing homes. To ensure premium dollars are spent primarily on healthcare, the law generally requires that at least 85% of all premium dollars collected by insurance companies for large employer plans are spent on healthcare services and healthcare quality improvement. For plans sold to individuals and small employers, at least 80% of the premium must be spent on benefits and quality improvement. If insurance companies do not meet these goals because their administrative costs or profits are too high, they must provide rebates to consumers. Okay, the law transitions in 2012 at the beginning of the year, improves the quality and lower costs by linking payment and quality outcomes, encouraging integrated health systems, reduces paperwork and administrative costs, and still increases access to affordable health care even more. The law establishes a hospital-based value-based purchasing program, VIB, or VBP in traditional Medicare. This program offers financial incentives to hospitals to improve the quality of care. Hospital performance is required to be publicly reported, beginning with measures relating to heart attacks, heart failure, pneumonia, surgical care, healthcare associated infections, and patients' perception of care. The Patient Protection and Affordable Care Act law provides incentives for physicians to join together to form accountable care organizations. These groups allow doctors to better coordinate patient care and improve quality, help prevent disease and illness, reduce unnecessary hospital admissions. If accountable care organizations provide high quality care and reduce costs to the healthcare system, they can keep some of the money that they have helped save. So that's a good incentive. The healthcare remains one of the few industries that relies on paper records. The new law will institute a series of changes to standardize billing and requires health plans to begin adopting and implementing rules for the secure, confidential, electronic exchange of health information. Using electronic health records will reduce paperwork and administrative burdens, cut costs, reduce medical errors, and most importantly, improve the quality of care. To help understand and reduce persistent health disparities, the law requires ongoing or new federal health programs to collect and report racial and ethnic language data. The Secretary of Human Services will use this data to help identify and reduce disparities. So the law transitions in 2013. And in the law, it expands improving preventative health care coverage, expands the authority to bundle payments, and continues access to affordable health care even more. The ACA the Patients Protection and Affordable Care Act expands the number of Americans receiving preventive care. The law provides new funding to state Medicaid programs that choose to cover preventive services for patients at little or no cost. The law establishes a national pilot program to encourage hospitals, doctors, and other providers to work together to improve coordination and quality of patient care. Under payment bundling, hospitals, doctors, and providers are paid a flat rate for an episode of care rather than a current fragmented system where each service or test or bundles of items or services are billed separately to Medicare. For example, instead of a surgical procedure generating multiple claims from multiple providers, the entire team is compensated with a bundled payment that provides incentives to deliver the healthcare services more efficiently while maintaining or improving the quality of care. It aligns the incentives of those delivering care, and savings are shared between providers and the Medicare program. As Medicaid programs and providers prepared to cover more patients in 2014, the Act requires states to pay primary care physicians no less than 100% of the Medicare payment rates in 2013 and 2014 for primary care services. The increase is fully funded by the federal government. Individuals, small businesses can buy affordable and qualified health benefit plans in this new transparent and competitive insurance marketplace. That's good. So in 2014, the law transitions also into hard protections of the for consumers in the Patients for Affordable Care Act. It prohibits discrimination due to pre-existing conditions or gender. It eliminates annual limits on coverage. And it ensures coverage for individuals participating in clinical trials. Also, in the individual and small group market, the law eliminates the ability of insurance companies to charge higher rates due to gender or health status. The Patient Protection Act, or the Patient and Protection Act, implements and reforms and prohibits companies from refusing to sell coverage or renew policies because individuals with pre-existing conditions. The law also prohibits new plans new plans and existing group plans from imposing annual dollar limits on the amount of coverage an individual may receive. Insurers will be prohibited from dropping or limiting coverage because an individual chooses to participate in the clinical trial, which I mentioned before. It applies to all clinical trials that treat cancer or other life-threatening diseases. Tax credits to make it easier for the middle class to afford insurance will become available for people with income between 100 and 400% of the poverty line who are not eligible for other affordable coverage. In 2010, 400% of the poverty line comes out to about $43,000 for an individual or $88,000 for a family of four. The tax credit is advanceable, so it can lower your premium payments each month rather than you waiting for tax time. It also is refundable, so even moderate income families can receive the full benefit of the credit. These individuals may also qualify for reduced cost sharing, co-payments, co-insurance, and deductibles. Starting in 2014, your employer doesn't offer insurance. You will be able to buy it directly. If your employer doesn't offer insurance, you will be able to buy it directly from the health insurance marketplace. Individuals and small businesses can buy affordable and qualified benefit plans in this new transparent and competitive insurance marketplace. The marketplace will offer you a choice of health plans that meet certain benefits and cost standards. Starting in 2014, members of Congress will be getting together their healthcare insurance through the marketplace. and you will be able to buy your insurance through the marketplace too. The law implements the second phase of the small business tax credit for qualified small businesses and small nonprofit organizations. In this phase, the credit is up to 50% of the employer's contribution to provide health insurance for the employees. There's also up to a 35% credit for small nonprofit organizations. Americans who earn less than 133% of the poverty level, approximately $14,000 an individual and $29,000 for a family of four, will be eligible to enroll in Medicaid. 100% federal funding for the first 3 years to support this expanded coverage, phasing to 90% federal funding in subsequent years. So it decreases over time. Get folks correct. Americans who earn less than 133% of the poverty level, which is approximately $14,000 for an individual and $29,000 for a family of four, will be eligible to enroll in Medicaid. States will receive 100% of federal funding for the first 3 years to support this expanded coverage, and then phase into 90% federal funding in subsequent years. So under the law, most individuals who can't afford it will not be required to obtain basic health insurance coverage or pay a fee to help offset the cost of caring for uninsured Americans. If affordable coverage is not available to an individual, he or she will be eligible for an exemption. And that transitions into the sixth point, which is in 2014-15, the Patient Protection and Affordable Care Act also continues to improve quality, also continues to lower costs by paying physicians based on value and not volume. This is a big one. The provision will tie physician payments to the quality of health care that they provide. Physicians will see their payments modified so that those who provide higher value care will receive higher payments than those who provide lower quality care. So, in conclusion, the United States, they spent more than any other nation in 2011 from that study that the WHO had performed. And this is a national crisis, and economic balance must be established to eliminate the threat in our country. The Patient Protection and Affordable Care Act in this nation is this nation's biggest and most recent attempt to address this national epidemic. Therefore, we started with the key features of the Patient Protection and Affordable Care Act as the first step to understand the law by examining new consumer protections, implementing in 2010. We reviewed how the law improved health and quality and lower costs and increased access to affordable care, and held insurance companies accountable with consumer protections in 2011. We talked about how the law continued to improve quality and lower costs by linking payments to quality outcomes, encouraging integrated health systems, reducing paperwork and administrative costs, and still increase access to affordable health care in the year 2012. We recapped how the law expands the authority to bundle payments in 2013 and how hard consumer protections are in place in 2014, which prohibits companies to discriminate due to pre-existing conditions, gender, and clinical trial participants. Lastly, we discussed a major milestone in the Patient Protection and Affordable Care Act starting in 2015 by paying physicians by quality and not quantity. Now that we've covered key features of the Patient Protection and Affordable Care Act, maybe those who require it can use this speech as the first step to make an informed decision about their individual health care. The decision truly is life or death. Thank you.